If you guide somebody toward good health, I like to jump to age 40 because I think at 40 the body begins to try to break down. So what are you looking for at age 40? What testing and what advice do you give somebody at age 40-ish?
Well, sure, and we're still going to talk about the same things that we talked about in 20-year-old. What are you doing from a lifestyle standpoint? Are you physically active? Because that's so important. How are you eating? Are you eating too much? Alcohol use. And then we'll look more at things at blood work, although still lipids, cholesterol panel, and blood sugar are the keys, but I'll check kidney function for sure, and maybe blood counts if it seems appropriate, maybe a thyroid screen if it seems appropriate.
Yeah, so there are things that you can begin to think about. How's the thyroid? How's the metabolic function? What's their sleep pattern? What do they look like? How vibrant do they look when you're talking with them? Do all those things fit into your evaluation?
Absolutely, absolutely. And you'll get a sense of, and again, I keep coming back to the physical activity, but I think any activity is good, and it doesn't have to be competing in triathlons. It can be walking, it can be a variety of things, but regular physical activity is good, and more tends to be better.
So what do you tell somebody if they say, well, I'm active, I get out of bed and I do things during the day and I end up going to bed at nighttime, but they don't have a set pattern. Do you ask people to have a set pattern of activity?
If I think it's advantageous for them, yes. So I think if they're not overweight and if they're sleeping well, eating well, and don't have a set pattern of physical activity, I don't know that it's worth trying to change that, because sounds like it's working for them. But if it's not, if they're overweight, if they're tired, if they're not sleeping well, then I think we need to look at how we can change that.